A nurse aide decides to reposition a dependent client every 4 hours instead of every 2 hours. This could be considered. Answer: negligence. A client frequently expresses concerns about their care. The nurse aide should. Answer: listen carefully to show concern and willingness to help. During a bed bath, the nurse aide should cover the client to expose only the part being bathed to. Answer: provide privacy and dignity. The most important care for a client with a cast is to. Answer: report changes in color, movement, and sensation. For oral care for an unconscious client, the nurse aide should position the client. Answer: on the side, lateral position. When caring for an agitated or confused client, the most important task is to. Answer: protect the client and others from physical harm. When working with a client with Alzheimer's disease, it is important for the nurse aide to. Answer: provide a regular routine for the client. To maintain a client's independence, the nurse aide should. Answer: allow the client to do as many annals as possible without assistance. A client's pulse oximetry reading is 95%. The nurse aide should. Answer: record the finding in the chart. Which document informs the nurse aide of the client's needs? Answer: care plan. To orient a new client to the facility, the nurse aide should. Answer: introduce the client to staff and other clients. To position a client in the supine position, the nurse aide should place the client. Answer: on their back. If a client falls and suffers a deep cut on the forehead, the nurse aide should. Answer: call for help and stay with the client. The family of a diabetic client brings cookies as a bedtime snack. The nurse aide should. Answer: notify the nurse about the cookies. After turning a client, the nurse aide should ensure. Answer: the signaling device is within reach. To assist a visually impaired client in ambulating in an unfamiliar area, the nurse aide should. Answer: offer an arm to the client. When giving a bed bath, the nurse aide should. Answer: cleanse the eyes from inner to outer corners.